Hi everyone, this is Dr. Raksha. I'm a general surgeon practicing in Chennai, India, and I'm about to be a surgical oncologist. And I use LiquidText to accumulate all the data and get all my guidelines and book information consolidated in one place and help me meet deadlines and plan my patient related information for each of my surgical procedures. I create all documents and I create a project. In the project, I add all my documents related to the project. Like I have to refer a lot of books, like when it comes to cancer, it is about multiple stages, and each stages would have a different type of modality of treatment. And there will be many references online in literature in as terms of research articles and even books which I have to refer. So I get all those books and the online web pages and research articles in one place. So I get all that information, which I can easily pull off all the books and get it on my workspace. And at the end of the day, I can just refer the workspace for what I need to do when a patient with, let's say, a stage 1 breast cancer comes, whereas to stage 4 cancer. So I can have all that information in one place. So that way, it's easier for me to just go through the workspace and get the whole idea of the particular disease.
Can you describe the types of materials that you bring into LiquidText?
Mostly it's the pre-op planning which I do. So it'll usually be the research articles online. If I want to see how many patients, if it's a rare condition with some metastasis elsewhere, I get the research article on those very rare instances. All those or I'll just go back to PubMed and search what are the articles published till now. I get those research articles in either PDF or in the web page format. And then I also have the books, the surgical oncology textbooks, which I can publish by various authors in Europe, USA, Indian authors. So I have all those hard textbook materials in PDF format. Also, the latest updates I supplemented with the research articles, and also we have the NCCN, ESMO, all these guidelines which have been given by the cancer groups all over the world. So we have NCCN apps which have the guidelines in a PDF format. So I put those in and get it all together.
Can you talk about
So
how, when you've got all those materials together, how you use LiquidText to mark them up and convert them into a form that is more useful for you?
So I go through whatever notes I have. Let's say I have a seminar where I have to describe about splenectomy. So I get information about all the indications of we have so many atlases on how the procedure is done. So I get all those information, like all those images and the text, the procedural details, the small indications, complications, all those information in one place. And I usually go through the project itself as a last minute revision. So based on that, I make PowerPoint presentations. I basically use it as a means to consolidate all my data, because it's easier to, just pick the stuff out from each textbook and just put it in one place. Like if you want to handwrite it like the olden times, you wouldn't find space to fill in different details from the other books. Like I find two indications, two complications in one book. If I refer to another book and I see two more information like related to the complications, then I can just put those, I can have a heading of complications and it is pull all the text together and I have it all there. So I don't try to export it out of LiquidText. I try to retain it in LiquidText for me to, I feel it more comfortable to keep it in LiquidText and see the entire thing at the end of the day. So From that, I extract the information and I just make it into a PPT, and it becomes much simpler. And I also can know where I have picked it from, because it has obviously the reference below that I have picked it from the Devita textbook. So that way it's easier to go back and see if I want to refer more about anything else regarding that.
I presume you're using the excerpting capability to drag the information
Exactly.
into the workspace.
Exactly.
Do you also use things like color coding?
I have tried because the cancer, there comes a lot of things like etiology or the risk factors, and then there are diagnostic imaging and other biopsy confirmations, all that. And there's another aspect to treatment as per stage, if it is metastatic, non-metastatic. So I have tried to find my own kind of color coding. I color the statistics as pink, and then diagnosis as blue, and then management as per different stage. If it's metastatic, I put it red. So when I color tag it, so if I want to know, and in surgical oncology, there's like head to toe, you can have any malignancy. So as per each malignancy, if I search for penile cancer and I see all the pink things, and I know all the epidemiology related to it, what's the mortality, what's the incidence rate. So I have it at quick go that when I color code it, I get all the things together. So that way it becomes easy for me. If I have to see all the epidemiology of all the cancers, and I have it all it being in pink, so I just search it through.
Do you also use the tag capability?
I have tried a few times, but I'm lazy to tag and code them. So I just use the color, which makes it easier.
Do you use a tablet of some kind?
I now use iPad Pro for my learning.
How long ago did you discover LiquidText?
About 5 or 6 years back, I saw my professor when I was preparing for the entrance exam for the for on becoming a surgeon. That was about 5 years back, I guess. I saw my professor use it and say, "See, you can. It's a very good tool for learning."
How many of your fellow medical students, perhaps your teachers, the other physicians you know at the training hospital, how many of them are using LiquidText?
I've seen users, margin note, notability, those apps, and suddenly I show them that something like this is there, then they're like amazed. They're like, "What did you just do? You just pulled out a text?" That was the response which I got. Even I was surprised that you can just pull off the text off the textbooks and just put it all together. So I think that one facility is amazing. That's the thing which I loved about LiquidText, and which I feel is good, because as a in the medical field, you have lot of information pouring in every day, and there are a lot of academic discussions which happen at our level. There are many conferences happening. There are many seminars, journal clubs. So you have to have all those right, especially in the current level which I am, probably another few years, and then I have to think about other things as a patient related, planning related thing. But for now, as a trainee, they require me to stuff all the information in my head, and this way I can get it all in one place. So that way I think this helped me, gives me a top notch over other things. So exporting thing is very auto exporting thing is very good. That's the feature I love, and I have made my colleagues also see that, and like, okay, that's interesting. That's what response I've got. So a couple of them have recently, I think, subscribed to LiquidText.
In relation to your exams, are they open book or closed book?
They're all closed book.
So you need to actually remember everything that you
Register
wrote.
all those details.
How does LiquidText help you remember things? Are there particular techniques you use in LiquidText to help you remember?
I use kind of mnemonics to things to keep this, and I follow a sequence. So given a topic, I divide it into few headings. I use the text box. I make few headings. So I remember those headings. And then if I want to go to etiology of endometrial cancer, so I just put heading of etiology. Then I go with tamoxifen and obesity. So I have the heading of risk factor. Then I have the heading of a pathology. Then the heading of pathology, I add things, what will be the biopsy, what will be the usual report, what are the histological types. Then when it comes to what imaging I want to do, I put a heading imaging, and then CT, MRI, or PET CT, and then comes the finally the stage wise distribution. So I classify to early stage, late, advanced stage, and then metastatic disease. So when I put those headings in place, then I can remember the content which is inside. So I get the headings right so that I can remember the content right. So that way, and at the end of the day, if I just go through the project which I have, I can remember all the information which is there in different books. Like for gynae oncology, I have to read a couple of books. Most common ones are Barrack and Hacker and Devita. So if I have all those information, I don't need to read two books. I can just read one book, one project which I have consolidated the matter, and I can remember it. So that way, and it's easy for me to revise, seeing the same thing again and just recollecting it and remembering the headings. And I teach my juniors using LiquidText. So I pull out the information saying, see, this important thing is this. Then I also annotate on the text. So annotating actually helps me. I remember I raise questions when I read the text. Like, okay, so what's the risk when you use tamoxifen? So I just annotate on the PDF saying, okay, what's the risk question mark. And then when you annotate, that sticks with you. With I have kind of a photographic memory, so you can remember through the annotations, and then you can get through it. And I would have probably given some 35 exams by now, all closed book exams, to reach where I am. So uh, I mean, now it's just easy. You don't panic when there's an exam.
You have juniors that you're teaching as well as being a student yourself.
Yeah, we have the residency for 3 years. So I'm currently in the second year. So I have my juniors who then first year who joined about 6 months back. So I would have to when we go through a patient who's posted planned for surgery tomorrow, the previous night when we ask the patient history and register through all their information, go through their imaging, whatever imaging had been done, biopsy details, what surgery is planned, then to help me learn as well. This is a Feynman technique. I'm sure everybody would know the method. So I just take a piece of paper and I open my LiquidText on project which I have information about. Currently I'm in breast and gynae, so I talk about endometrial cancer. Then I pull out my project and I say, see, this is information you need to see in the patient, and this is how planning is done. So when I put it across that way, when they see only the text which is important, like leaving out the rest of the textbook, they find it much easier to understand. And what retains is all those important words which you have to remember. My textbook runs in about 4,500 pages each books. So so when you have to gather data at the end of the day, what you want to retain in your memory, so it comes to the simplest ones which you highlight. But highlighting in other PDFs, it's very common. Now with LiquidText, I can just pull out the text together. It's much different from just highlighting the text in the textbook. So when I get it together, then that becomes very easier to run through. So I just have the important points at the tip of my fingers. So I just, it's easier for me to translate the same to my juniors as well.
Do you have brainstorming sessions with your juniors? And do any of your juniors use LiquidText in that way with you?
I have managed to show them how it works. So yeah, like I said, Dr. Kushbu is one of my colleagues. So I told her about this, and she's like, "You just took it like this and put it. I want that. What is that?" So she was very enthusiastic about that. So immediately she downloaded the app, and she started to see how it works. So I think she subscribed a couple of months back. So when we sit together, then she shares some of her projects which she has done. So that way, I can add on to more information from my end. Like she would have done a basic reading of the general textbook, and I can add the updated version of what the current guidelines across the world is practicing on cancer.
Do you bring multiple PDFs into view side by side for comparison's sake?
I do.
How do you use that in your work?
So again, when I said about the almost all textbook have a sequence. They start with the epidemiology and then the pathology, etiology, and the pathology. So I have both things together, like probably an Indian based textbook and probably a broad based book. So I compare how the epidemiology is in India and how the epidemiology is there abroad. So when I have those two books side by side, I can just, take the information and see the statistics in both places. So that way I can compare things as to what additional information each books can give. The similarities and the differences, I can just get that together under the same heading.
Does LiquidText actually change the way you engage with the information, cognitively speaking, to generate
Exactly.
better and more insights from the medical data that you assemble?
Yeah, you fit in perfectly. I think that's what it does to me. It's very good in that sense.
Are there any examples of how it's helped you generate fresh insights that you mightn't have otherwise been able to achieve?
So when I pull the information, I think on it. So I one few textbooks generally be very simple and few are elaborative. So when I get things together, when they say that tamoxifen is a risk factor for endometrial cancer, there's no explanation to this. Then you start thinking, okay, why is it so? What's the etiology behind? Why is this a risk factor for the disease? Then when you see elaborative books on that, then you would have a big solid explanation for the same. So I can get that side by side and have thinking, and that point registered as in, okay, this is the risk factor and the reason for this is this. So it helps me think better and consolidate the information.
Raksha, does using LiquidText speed up your studying processes so that they take less time?
Actually, if I have to if I have to open some PDF reader and start annotating, it would take me a lot of time to assimilate the same matter. I have to highlight through everything, and then I have to go through all pages to see whatever I've highlighted. Whereas in LiquidText, I can just pinch and I can have all those the highlighted things together. Or if I expert, then I have all the experts together. So, and I can use multiple books. The reason initially after the free subscription, why I bought after the basic version, why I bought LiquidText for the lifetime thing was that I wanted more documents to be added in. So when I had that option, then I was happy that I can have 2-3 books related to the particular topic, and then I can get it together. And it's so convenient for me to, instead of going through multiple books, I can just have a look at my project and I'm just done. So that speeds the process, yes, tremendously.
Is it part of the medical learning process for you to have to defend your medical opinions or conclusions?
These days we practice called evidence-based medicine. So we should be having we should be showing the evidence, like what's the complication rate currently, that's a quality indicator. So when it comes to that terms, then yeah, I should have a solid backup of what literature says about this particular situation. So in that sense, yes.
So being able to jump back to the source of some information
Source,
you can in
exactly.
LiquidText
So
is a big help for that.
yep. So I can know where the information is from. So it's easier to, quote that and say, see, this, I have cited this article. So it's based on this article that I'm saying all these things.
This was an amazing insight into how you do your work, how you study. Thank you.
That's very kind of you to say.